Hey guys, how are you? I hope you're well. So today I did my pre-op stuff unless there's something else they need later, which I don't think there is, but who knows. They said I don't need a chest x-ray. They usually do that pre-op, depending on the doctor. They'll do that pre-op to make sure your lungs are in good condition so that you can handle being intubated and there's no complications with that. So I didn't have to do that. I just had the x-rays of my foot and what else? Blood work. See, had blood work done. I think I could probably take that off now. I think. Yeah. Um, and that's pretty much it. And a bunch of questions. Are you allergic to anything? Do you ever have a hard time when they wake you up from surgery? Do you have any reactions to anesthesia or anything like that? Which I don't. And of course, they ask you the typical questions. Do you do, any drugs, any alcohol? What are the medications that you're on? The typical routine questions that they ask. And I want to clarify something too, which I knew logically that it didn't make sense, but the only way that a bunion can be fixed is through surgery. There are, these contraptions that you'll see online, you'll see on Amazon. All these people are selling these items. Don't get me wrong. I'm sure they work well. And they kind of pull your, toe back over. However, my nose is tickling. They do not permanently train that toe to do the right thing. So you'll see an advertisement where it'll show you this is what it looks like before, and this is what it looks like a month from now, and this is what it looks like. It's aligned. Your bones are aligned properly 3 months or whatever the time frame is. That is a lie. Okay, that's a lie. That you cannot train your bones to align themselves. They have to be made to do that surgically. Now, if a person decides they're never going to do surgery, they're just going to stay with a separator. You put it between your toes or whatever, or a splint. They're just too terrified of surgery. Then that's what that person's going to do. But I would like it repaired. I would like it fixed. And again, it doesn't do it on its own. So it's got to be encouraged to do it, if that makes sense. All right. So they're going to put 2 plates in there. They're little plates. I think they're about that big. And what he does is he goes to the bottom of the toe. All right. So say the toe is this way. Okay. What he does is, this is where the bone, the dislocation of the bone starts here. So that's where he goes in at. And he will, he didn't tell me exactly, because he knew I was freaking out. But I already know. They sometimes go in there and they slice a piece of bone out and then they align the, I don't think he wanted to go into too much detail about that. But I have an idea, a general idea. So I said it's not he wants to do a bone fusion. And I said it's not a Lapiplasty. He said yes, it's very similar to a Lapiplasty. So they go in there and they, slice a piece of bone out. And he didn't tell me that part, but I saw that because I researched it. Sometimes you know too much, and you probably shouldn't, because that'll freak you out more. So I don't think I'm going to watch any more of those procedures. I think I'm going to chill. But I remember when I broke my leg. So I had a tib-fib fracture and I had partial ankle involvement. And the nurse told me they have to set your leg. So they're setting it before surgery. So it's already lined up and everything. And she said, and it's going to hurt. It's going to hurt. But you can be sedated, but it'll take longer for them, for us to actually sedate you, because this is when a couple years ago when I broke my leg. For some reason I was thinking about this. She said, the pharmacy has to mix the ingredients to make to combine the medicines for the sedation. So I'm like, yeah, let's do that. Honey. That was weird. Because I'm going to tell you exactly what it was like, okay? This is going to sound so bizarre, but I'm telling you, I'm just keeping it real. You remember those dolls that stood up from the floor? They were a couple feet high, and they looked like they're staring off in the distance, but their eyes moved, like their eyes were loose in their head. That's how I felt when I was sedated. Honey, I didn't close my eyes initially. I should have. Kept my eyes open. And I felt like my eyes, I'm going to keep it real with you, okay? I felt like my eyes were doing this. Both of them just going in opposite directions, going all over the place. I felt like I had no control over my eyes. And I remember one of the girls in the office, not in the office, in the room, when they were going to sedate me. I mean, they already were sedating me and getting ready to set my bones. And I think she saw my eyes like going everywhere at the same time, just like, And she said, I'll never forget her. She said, go to your happy place. And I'm like, okay. So I closed my eyes and I slid into Never Never Land. Okay? Drugs are great. Not illicit drugs, proper drugs. Medications are great. I didn't feel any pain, which is beautiful. You already suffered with the severe injury. You don't want to suffer with the treatment if there's a way that they can reduce your suffering. You know what I mean? So all I felt, I had my eyes closed the whole time, because you don't want to, I felt like with my eyes open, I'm resisting it, not on purpose, right? But you just gotta close your eyes and let yourself be taken away to the Starship Enterprise. And only thing I felt, it felt like somebody was pushing my leg into their chest. That's all it felt like. It's weird. It's super weird. That's what it felt like. That they were just pushing my leg into them. I don't know what was going on, but they aligned it and I had my surgery and life was grand. And I didn't have to suffer through it, so that was even better. It is so warm today, and it sucks. It's just too warm. I like when it's cool out. It's not cool in any way, shape, or fashion. It's not cool. It's almost like a second summer. It could be a little cooler, and I'd be happier. So anyway, my surgery, I don't know if I told you, my surgery is November 13th. And they'll tell me what medicines to stop taking for a week prior to surgery. And I already know where to go when I get to the building. I have to go to the main doors and then go downstairs. That's where the OR is. And I have to be no weight bearing for 2 weeks. And yeah, and then gradual weight bearing after that. And that sort of thing. So anyway, that's what's going on. November 13th. I just wanted to get it over with as soon as possible. I don't want to go into, like I said, we usually have mild winters here in Missouri, but who knows? That can change at any time. You know what I mean? Our weather is so unpredictable. But I don't want to potentially go into ice and snow wearing, using a knee scooter and things that are not exactly designed for slippery conditions. Let's just not do that if we can avoid. So just had blood work done, and like I said, I think I'm good to go. I had the X-rays on my foot, and I think that's all they require at this point. Probably depends on the doctor how extensive they want your pre-op to be. And that's pretty much it. So one more thing that was a tragic situation, and I I cried. I ain't gonna lie. I got very emotional about it. And instead of fighting the tears, I just let it go. Um, so there was a lady, she's part of the Sikh community, Sikh, I think. And she was working at the Walmart in Halifax, Canada. And the walk-in bakery, she was inside cleaning it. And she somehow got locked in there. And she was screaming and they couldn't get the door open. She died. Okay, she died. That's a horrific way to go. That's a horrific way to go. I can't even begin to imagine what she felt. The nightmare that was going, and you don't have to have a degree in business to know that there should be an emergency button that cuts off the power, or an emergency something that you can press so that that doesn't happen. One of the articles said that she was screaming, but nobody could get the door open. They don't know if there was foul play involved. They don't know if it's a hate crime because she was with the Sikh community or religion. I believe it's a religion. I don't know much about it, to be honest with you. But they're going to do whatever they can to help the family. But I smell a massive, massive lawsuit. Because it doesn't make sense that there's not an emergency exit so that you don't get trapped in an oven and cooked to death. So if you guys could say prayers for her friends and family, that would be good. That would be really good. It just defies logic. And like one of my friends said, he said, somebody in one of the articles I read, it said that the oven is always on. He said, then why couldn't they cut the power? And if they had to cut the power to the store, then that's what you do. You don't leave the person in there. It just defies common sense that there wasn't a way for her to get out. So, if you could say prayers, I just hope that people, one article said that she was screaming and they couldn't, like I said, they couldn't get the door open. I don't know if there was foul play involved, and the investigators don't know either. So, yeah, we definitely need some prayers, and it just defies logic. Like I said, you don't have to have a degree in business to know that that should be, an emergency exit should be implemented in anything similar to that that's potentially deadly. I mean, come on. I just don't get it. I just don't get it. But if you could send some prayers up, that would be great. Okay. You guys take care, and yeah, be safe. Talk to you later.